Imagine the moment when you discover you're expecting a child and the first thing you're offered is an abortion. Or the judgment of being sent to a genetic counsellor in case your child is born with your disability. Or you're made to feel like an alien because they haven't treated a pregnant woman like you before.
Every time that I've been pregnant, I've hidden it from the world because of the stigma. Why you're having more children? Is one not enough for you? How will you cope? It's always been a fight, fighting for access, fighting for your needs, fighting for social services. But when I first gave birth to my child, that's the first time in my life that I felt like this is mine and no one can take this away.
1 in 5 women of reproductive age are disabled. Ramiza has cerebral palsy and dystonia, which causes spasms in the limbs and face and can make talking difficult too. She's asked for her words to be subtitled. In an earlier birth, Ramiza experienced the excruciating pain of having her legs forced into stirrups. So when things started going wrong in her last pregnancy, she sought help early.
I kept telling them that I'm in pain. I went into A&E 5-6 times and they would send me home by saying that's part of your disability. And I could feel that the movement had significantly reduced. They said probably, or you probably didn't feel it because you had a spasm or because you take painkillers. They had under 2 minutes to get the baby out. Where are you going? Oh.
Ramiza's story chimes with emerging evidence that disabled women's outcomes of pregnancy, birth and postnatal care are much worse than non-disabled mothers. A new report published by the London School of Hygiene and Tropical Medicine and exclusively shared with Channel 4 News also highlights negative attitudes and lack of knowledge and skills of healthcare workers. Ramiza's experiences left her feeling isolated, but they are sadly not unique. Through a charity for disabled women called Winvisible, she has begun meeting up with other local disabled mums. Their stories are strikingly similar. Rupi is a psychologist and recently had her first child.
I remember at the time I was dead worried about telling everyone that I was pregnant because of those assumptions, like how are you going to look after your child? You require 24 hours support yourself, so who's going to be looking after who? And it's quite a horrible feeling, isn't it, when it's supposed to be such a joyous time.
Hello. 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 Oh, you can have that if you want.
Being judged a lesser mother as a feeling shared even when you're an ex-Paralympic athlete like Carly. She had previously felt free of many of the biases disabled women face.
People were really, really happy for me, but there were people that would say, oh, congratulations. Have you had the sign-off that you're okay to give birth? I ended up tapping into my competitive side and being like, I can do this. Yeah. I can give birth.
Sleepy. I've had people come up to me and say, are these your children or is it your sister's children?
Rupi went into labour 8 weeks early. Her consultant wasn't on duty and she says there was panic because no one had dealt with her condition before.
I was in a room by myself with 10 health professionals and they were asking me questions like, did they think that it could push? What did I think about this pain relief? And I was panicking anyway because I knew that my son was coming earlier than I anticipated. So that was in the back of my mind. Never mind, me advising them like, could I push? How do I know? I don't know.
Rupi's consultant arrived and she had a positive birth. But with NHS maternity services stretched, many new mums, regardless of disability, will say they didn't have a good birth. For disabled women, the negative effects of that are magnified.
Yeah, no, I love that one. That sort of...
Oh, this is the one up into the...
and that just...
That's why MP Murray Tidball has launched a campaign to improve care for disabled mothers, backed by the findings of this report.
Part of disabled people being celebrated and accepted in our society is understanding how we live our lives. You know, my sense is that people don't think about disabled women having babies. You know, they don't think about us getting pregnant, and a lot of that
She's driven by her own experiences of giving birth 7 years ago.
No one had thought about, well, actually, you might not be able to fit your prosthetic limb, so your pregnancy might affect your mobility. I saw a registrar, and I said, you know, am I going to be able to have a natural birth? And he said to me, well, can you open your legs? And I'd been saying, like, have you got my x-rays?
What should they have done?
They should have just better understood how the physiology of the person in front of them may interact with their experience of pain, the kind of birth that they can have, the additional support that they might need.
We put these concerns to NHS England, who told us,
"It is upsetting and unacceptable to hear of cases where the care of pregnant women with disabilities fell far below the standard we'd expect. We know the NHS has much more to do to listen and learn from families, which is why we are working with the government on a 10-year plan for the NHS to ensure maternity care is safer for all women and babies before, during and after birth."
For Ramiza, she is determined to enjoy the family she has created.
I live being a mum. It's who I am now. I'm actually quite proud of myself for bringing them into the world with all the struggles that I've had. I'll keep fighting until the last, just keep them safe and happy.